Hi and welcome viewers of Nursing Academy 101. In this video we'll talk about latest reduction of risk potential related multiple choice questions for nurses along with the answers and rationale part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. Which of the following statements by a client indicates a good understanding of a bone marrow biopsy to obtain a laboratory specimen? A. The procedure will take less than 5 minutes. B. I can go for a walk right after the procedure. C. I will be given medication to minimize discomfort. D. It's okay if the injection site becomes swollen. The answer is C. The client's understanding is adequate if they know they will be given medication to minimize discomfort during the procedure. The other statements either provide inaccurate information or indicate a lack of understanding. Question number 2. What should the nurse do when observing bleeding from the injection site of a bone marrow biopsy? A. Monitor the bleeding. B. Document the finding. C. Notifying the in-charge nurse. D. Applying pressure to the site. The answer is D. Applying pressure to the site is the correct intervention to stop the bleeding. The other options are not appropriate actions for addressing the bleeding. Question number 3. Under which condition would conducting iron studies be warranted? A. Anemia. B. Diabetes. C. Pneumonia. D. Myocardial infarction. The answer is A. Iron studies are conducted when there is a suspicion of anemia, not for the other conditions. Question number 4. In clients with diet deficiencies in which food, vitamin B12, cyanocobalamin levels may be low? A. Lettuce. B. Apples. C. Broccoli. D. Eggs. The answer is D. Vitamin B12 is found in eggs and animal proteins, not in the other foods mentioned. Question number 5. If a client's diet is deficient in what food, they may have low folic acid levels? A. Spinach. B. Eggs. C. Orange. D. Bananas. The answer is A. Folic acid is found in dark green, leafy vegetables such as spinach, not in the other foods listed. Question number 6. Oral intake of which of the following may cause decreased folic acid levels? A. Milk. B. Alcohol. C. Orange juice. D. Coffee. The answer is B. Alcohol intake can cause decreased folic acid levels, not the other options. Question number 7. Ingestion of which of the following medications may cause decreased folic acid levels? A. Cardiazem, diltiazem. B. Rocephin, ceftriaxone. C. Dilantin, phenytoin. D. Betapace, sotalol. The answer is C. Dilantin, phenytoin is an anticonvulsant that acts as a folic acid antagonist. The other medications listed do not cause decreased folic acid levels. Question number 8. Which value for an adult hemoglobin level should the nurse immediately report to the physician? A. 19 microgram per deciliter. B. 16 microgram per deciliter. C. 12 microgram per deciliter. D. 9 microgram per deciliter. The answer is D. A hemoglobin level of 9 microgram per deciliter is significantly low and requires immediate reporting to the physician. The other options are within the normal range or slightly high. Question number 9. An increased hematocrit may be found in which of the following conditions? A. Hemodilution. B. Dehydration. C. Blood loss. D. Anemia. The answer is B. Dehydration can cause an elevated hematocrit level. The other conditions may cause decreased hematocrit levels. Question number 10. Red blood cell indices are useful for classifying which types of disorder? A. Cancers. B. Infections. C. Anemias. D. Fractures. The answer is C. Red blood cell indices are used to classify different types of anemias, not the other conditions listed. Question number 11. A client suspected of having which disorder might undergo hemoglobin electrophoresis? A. Sickle cell disease. B. Leukemia. C. Pneumonia. D. Electrocution. The answer is A. Hemoglobin electrophoresis is conducted to distinguish between sickle cell disease and sickle cell trait. It's not performed for the other conditions mentioned. Question number 12. Which part of the body is examined during a colposcopy? A. Cervix. B. Lungs. C. Colon. D. Liver. The answer is A. Cervix. A colposcopy is used to examine the cervix, not the other options. Question number 13. Which statement from a client indicates understanding of post-colposcopy care? A. I can use contraceptive foam tomorrow. B. I will place a diaphragm in now. C. I will use a pad to absorb the bleeding. D. I can have intercourse with my spouse tonight. The answer is C. I will use a pad to absorb the bleeding. It's expected to have a small amount of bleeding after a colposcopy, and using an absorbent pad is appropriate. The client should refrain from intercourse and inserting objects into the vagina until the biopsy site has healed. Question number 14. What's important for the nurse to instruct the client to do prior to an amniocentesis? A. Avoid eating after midnight. B. Avoid drinking after midnight. C. Urinate just before the test. D. Urinate just after the test. The answer is C. Urinate just before the test. Instructing the client to urinate before the amniocentesis helps minimize the risk of puncturing the bladder and aspirating urine instead of amniotic fluid. There is no need for the client to abstain from food or fluids. Question number 15. Which client is most likely to undergo an amniocentesis? A. A 28-year-old woman with hypertension. B. A healthy 40-year-old woman. C. A 32-year-old woman with depression. D. A healthy 18-year-old woman. The answer is B. A healthy 40-year-old woman. An amniocentesis is commonly recommended for women over the age of 35, those with a family history of genetic abnormalities, or those with a history of previous miscarriages. The other options do not meet the criteria for an amniocentesis. Question number 16. Mrs. Scott expresses her fear that the amniocentesis may indicate Down syndrome in her baby. What is an appropriate response by the nurse? A. Tell me more about your fear. B. You can always have an abortion. C. Down syndrome children are affectionate. D. You can handle it. The answer is A. Tell me more about your fears. This response encouraged the client to express her concerns and builds trust between the nurse and the client. The other statements are insensitive or dismissive of the client's fears. Question number 17. Mrs. Scott, a devout Catholic, learned that her fetus may have Down syndrome. According to her religious beliefs, which option would likely not be acceptable for her? A. Abortion. B. Blood transfusion. C. Surgery. D. Prayer. The answer is A. Abortion. Catholic religious beliefs typically prohibit abortion, but the other options are generally accepted within the faith. Question number 18. What is the normal color of amniotic fluid? A. Red. B. Clear. C. Yellow. D. Amber. The answer is B. Clear. Amniotic fluid is typically clear in color, not any of the other colors mentioned. Question number 19. What is the appropriate response of the nurse when an adult client expresses fear of passing out during a blood draw? A. Only children get upset by seeing needles. B. Try thinking of a pleasant scene from nature to relax you. C. Don't look at the needle and you will be fine. D. This will only take a moment to do. The answer is B. The nurse should suggest distraction techniques, such as thinking of a pleasant scene from nature, to help the client relax. The other responses are insensitive or dismissive. Question number 20. How should the nurse respond to a Jehovah's Witness client who refuses a blood transfusion based on religious beliefs? A. You are not serious, are you? B. You may die if you don't get some blood. C. You have the right to refuse the blood. D. I am required to give you this blood. The answer is C. The nurse should respect the client's right to refuse the blood based on their religious beliefs. Option C acknowledges the client's autonomy and respects their decision. Question number 21. What is the best documentation for a client who refuses a blood transfusion? A. Have the client sign a refusal form. B. Document the client's refusal. C. Charge notification of the charge nurse. D. Document a quote from the client. The answer is A. The best documentation for a client who refuses a blood transfusion is to have the client sign a refusal form. This provides a clear record of the client's decision and their understanding of the risks involved. Question number 22. Which of the following conditions can cause an increased erythrocyte sedimentation rate? A. Congestive heart failure. B. lupus. C. Polycythemia vera. D. salicylate toxicity. The answer is B. Lupus. A collagen disorder can increase the erythrocyte sedimentation rate (ESR). The other options may decrease the sedimentation rate. Question number 23. Which of the following conditions can cause an increase in the white blood cell count? A. Glaucoma. B. Dementia. C. Pneumonia. D. Atrial fibrillation. The answer is C. White blood cell count is elevated in infectious processes such as pneumonia. The other conditions do not typically cause an increased white blood cell count. Question number 24. What is a shift to the left in the white blood cell count? A. An increase in granulocytes. B. An increase in bands. C. An increase in monocytes. D. An increase in eosinophils. The answer is B. A shift to the left in the white blood cell count refers to an increase in immature neutrophils, specifically bands. The other option refers to mature types of white blood cells. Question number 25. For a client with a white blood cell counts less than 1000, what signs should the nurse be vigilant in assessing? A. Hypotension. B. Hypertension. C. Bradycardia. D. Fever. The answer is D. The nurse should be vigilant in assessing for fever in a client with a white blood cell count less than 1000. A fever could indicate the development of an infection. The other options are not specific signs related to a low white blood cell count. Question number 26. Which cell type is elevated in a client with severe burns? A. Neutrophils. B. Bands. C. Basophils. D. Eosinophils. The answer is A. Neutrophils are increased in conditions with tissue necrosis, such as severe burns. The other cell types are not specifically associated with burns. Question number 27. Which cell type is elevated in a client with leukemia? A. Neutrophils. B. Bands. C. Basophils. D. Lymphocytes. The answer is C. Basophils are increased in clients with leukemia. The other cell types may vary depending on the type of leukemia. Question number 28. Which cell type is elevated in a client with asthma? A. Lymphocytes. B. Monocytes. C. Basophils. D. Eosinophils. The answer is D. Eosinophils are increased in clients with asthma. The other cell types may not be significantly affected. Question number 29. Which cell type is elevated in a client with Hodgkin disease? A. Lymphocytes. B. Monocytes. C. Basophils. D. Eosinophils. The answer is A. Lymphocytes are increased in clients with Hodgkin disease. The other cell types may not be significantly affected. Question number 30. A client taking dilantin phenytoin for a seizure disorder has a low neutrophil counts on a white blood cell count test. What conclusion may the nurse make? A. The blood specimen needs to be redrawn. B. The neutrophils count may not indicate a disease. C. The physician needs to be notified immediately. D. The client has developed an infection. The answer is B. Dilantin phenytoin can decrease the neutrophils count, so a low count may not necessarily indicate a disease process. There is no immediate need to redraw the blood specimen or notify the physician. A high neutrophil count would indicate an infection. Question number 31. What type of precautions would the nurse take for a client with a white blood cell count less than 1000? A. Isolation precaution. B. Reverse isolation precaution. C. Respiratory isolation precautions. D. Scan precaution. The answer is B. The nurse would implement reverse isolation precautions for a client with a white blood cell count less than 1000. This is because the client is at high risk for infection and need protection from potential sources of infection. The other options are not appropriate for this situation. Question number 32. Which statement by a client indicates understanding of strict neutropenic precaution? A. I can eat lots of fresh bananas. B. I can have imitation plants in my room. C. I can eat lots of fresh tomatoes. D. I can eat lots of fresh cucumber. The answer is B. The client should avoid fresh fruits, fresh vegetables, and live plants because they may harbor bacteria or insects that could pose a risk of infection. Option B correctly identifies the need to avoid live plants, while the other option suggests consuming fresh products, which is not recommended. Question number 33. What statement by a visitor indicates adequate understanding of entering the room of a client on neutropenic precaution? A. I can bring fresh flowers. B. I can bring a fruit basket. C. I need to wash my hands. D. I don't wear a mask. The answer is C. Adequate understanding of entering the room of a client on neutropenic precaution include the visitor's commitments to washing their hands. Hand hygiene is crucial to prevent the spread of infection. The other options involve bringing items, flowers or fruits, or not wearing a mask, which are not relevant to preventing the transmission of infection. Question number 34. Which statement by the nurse best indicates empathy when talking to a client on neutropenic precaution? A. Tell me how it feels for you to be in this room alone so much. B. This must be a nice break for you to have some time alone. C. This probably makes you nervous to be here alone. D. I wish I had some time like this to be alone by myself. The answer is A. The statement that best indicates empathy when talking to a client on neutropenic precautions is tell me how it feels for you to be in this room alone so much. This statement shows genuine concern and invite the client to express their feelings. The other statements may make assumptions, minimize the client's experience, or express personal desires. Question number 35. Which statement by the nurse is most therapeutic when informing a client that she has leukemia? A. We have treatments for leukemia that are quite effective. B. Don't worry because your type of leukemia is treatable. C. Lots of people have leukemia and are successfully treated. D. How does it feel for you to hear you have leukemia? The answer is D. This statement is most therapeutic as it allowed the client to express her feelings. The nurse's presence and willingness to listen demonstrate care and support. The other statements may provide false hope and don't address the client's emotional needs.